Love this question, but before I answer, I just want to remind everyone I am a hater of drains, and so you'll get a little bit of a skewed answer about this, but let me explain to you why we use drains and why we're getting away from them in recent years. So drains are a little tiny device. It's a small tube that we put inside. It comes out through the skin, and there's a little receptacle that collects fluid. And we use these drains to remove fluid so that it doesn't accumulate under the skin and cause a collection called a seroma. Now, your body can handle a certain amount of fluid, but there's a tipping point, and once it gets over that tipping point, it can collect. So in the past, we used drains a lot more than we do now, but there's been a lot of studies in different areas of plastic surgery that has shown that drains really don't prevent the complications we thought they did. So in breast augmentation, which is what this video I believe is about, the patients with breast augmentation, the drains did not prevent seromas and hematomas. Now, there's also been studies on breast reduction patients that has shown the same thing, that the patients with drains in place did not have lower rates of these complications. So you have to ask yourself, why am I putting them in? And in the breast reduction paper, which I recently did a video on, they actually showed increased infection rates in patients that had drains. So in addition to showing that drains are not useful in certain operations, we've also shown that by doing an operation in a bit different way, you cannot need a drain. And we've seen that with tummy tucks. So with a tummy tuck, you can do them drainless, but you don't do it exactly the same as you do if you leave a drain. You do some stitching internally to try to prevent space for that fluid to accumulate. Now, breast reconstruction is really, I think, the main holdout for most of us. Even drain haters like myself still use drains for breast reconstruction. And that's because a lot of fluid tends to be produced when you're biopsying lymph nodes and removing the tissue of the breast. And so I do still think drains are needed for that, but if a study comes out and they look at this and the complication rates are the same with drains, no drains, I will get rid of drains because, again, I am a hater of all drains. And then I always throw out there that every single person that has surgery is different. Just because a study shows in a large group of people that something is not preventing complications, you as an individual may present a challenge to your surgeon in the operating room where they believe a drain makes sense for you. So every once in a while, I will place a drain because something seems different in the surgery and I feel like more fluid will be produced. So I'm hoping that as the years go on and we do more research in the area, we show that drains don't help in other surgeries as well, because I hate them. They're horrible. If you've ever had them as a patient, they're miserable. And if they're not helping, there's just no reason for them.